Hi, good afternoon. My name is Terika Thomas Mills, and today I'll be doing fluid and med administration, IV fluid and med administration. I'm gonna start by performing my hand hygiene, and then I'm gonna apply my gloves. I have gathered my supplies. I have my primary fluid. I have verified the physician's order in the MAR. I have verified the 6 rights of med administration. I have verified that I have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. For my primary tubing, I have my macro drip set. That is macro drip at 15 drops per minute. I also have my IV piggyback. The doctor has prescribed 250 milligrams of amoxicillin to be run over 15 minutes, and it's supplied in 100 milliliter piggyback. So for this, I have also verified the 6 rights of med administration for the amoxicillin. I have verified that I have the right patient, the right drug, the right dose, the right route, the right time, the right documentation. I have also verbally confirmed and checked in the patient chart that he has no known allergy to amoxicillin. Also, I have my secondary set that is macro drip at 20. It's macro drip at 20 drops per ml. Okay, so I have my alcohol prep pad, and I have my piggyback hangers. Let me just adjust my camera 1 minute so the hangers is in view of the camera. Okay, so I'm sorry. So I have my alcohol prep pad, and I have my piggyback hangers. So I'm gonna go ahead and I'm gonna spike my bag. No, before I do that, sorry, I am gonna start off by doing some calculations. Okay, so for my fluid, I have 150 milliliter, which is to run for 60 minutes, and it's supposed to run at 15 drops per ml, and that would be 38 drops per minute. And for my amoxicillin, it was ordered at 250 milligrams, which is supplied in 100 ml, and it is to run over 15 minutes, and it's macro drop at 20 drops per ml, so this would give us 133 drops per minute. Okay, so now I'm gonna go ahead and I'm gonna spike I'm gonna go ahead and I need to spike my bag and my primary line. But before I do that, for my primary tube, I have my spike end, and this is to remain sterile, since this is what is introduced into the medication bag. I have my drip chamber. This is what prevents the air from entering the it prevents the air from entering the tube, and it also allows us to visualize our drip rate. Next, I have my my roller clamp, and this is what allows me to adjust my flow rate. And before we start, we always have to ensure that it's in the off position. Next, I have my Y-Site, and this is what is used for med administration via IV bolus or IV piggyback or secondary infusion. And when we're going to be using this, we have to make sure that the medications are compatible with each other. And then finally, I have my adapter N, and this is the end that goes it gets connected to the patient's IV site. So now it's time to prime the bag. I'm going to prime the bag and prime the line, and spike my bag. I'm going to remove the top, and then I'm going to remove the top from my spike end. I'm going to spike my bag. And I'm gonna go ahead and hang my bag, but since I know I'm gonna be doing a piggyback, I'm gonna hang this lower. Okay, so now I'm gonna go ahead, in order to prime my line, I'm gonna squeeze my drip chamber until it's half full. Okay, now that it's half full, I'm gonna go ahead, I'm gonna slowly open my roller clamp. I'm gonna allow the fluid to run all the way through the line until all the air bubbles are gone. Okay, now that all the air bubbles are gone, I'm gonna go ahead and I'm gonna close it. Okay, so next I would use my alcohol pad, and I would clean the patient's IV site where I would attach this. I would clean the IV site, give it a minute to dry, and then when it's dry, I would attach the primary tubing to the patient's IV site. Okay, so now that it's attached, I'm gonna go ahead and I'm gonna slowly open my roller clamp, and I'm gonna ensure that my drip rate is accurate. For this infusion, I need to get 38 drops over a minute. So I am gonna slowly open the line, and I'm gonna check to make sure that my drip rate is accurate. I'm gonna count for 1 full minute to make sure that the infusion rate is accurate. Okay, so I have counted 38 drops in that minute. In the real world, I would allow the infusion to continue, but due to limited supplies, I'm gonna turn my infusion off, and then I am gonna set up my piggyback. Okay, so for the amoxicillin, I have my secondary line. Again, we always want to ensure that the line is closed. I have to make sure that my line is closed, and I am gonna spike my bag again, and then I'm gonna prime my line. So I'm gonna remove this, I'm gonna remove this, I'm gonna spike my bag, and then I am gonna hang this, And I always have to ensure that both my medication and my fluid is hung at least 30 inches above the patient's IV site. And of course, I'm gonna hang this above my fluid. Okay, so again, in order to prime the line, I'm gonna squeeze until my drip chamber is half full. Okay, now that my drip chamber is half full, I am gonna slowly open my roller clamp. Okay, I'm gonna allow the fluid to run all the way through until there are no air bubbles left in the line. After the air bubbles have been removed from the line, I am gonna close it, and then I'll take a new alcohol pad. I would clean my Y site. I would allow it to dry for a minute, and then when it's dry, I would attach my secondary line. I would attach it to my primary tubing. Next, I am gonna go back up the roller clamp on my antibiotics, and I'm gonna check that my my drip rate is accurate. For this infusion, I need to have 133 drops per minute. So again, I'm gonna slowly open my roller clamp, and I'm gonna count for 1 full minute. Okay, so I have counted for 1 full minute, and I have confirmed that the infusion rate is correct. It's actually infusing at 133 drops per minute. So then I would go ahead and I would reassess the patient's IV site. I would look for any signs of infiltration, any redness, any swelling, and if this happens, then we would pause the infusion. Since amoxicillin is a moderately high-risk allergy medication, I would check to see if the patient, I would stick around for a minute to check to see if the patient is experiencing any form of hypersensitivity or any form of allergic reaction. Okay, so a few minutes have passed and the patient seemed to be tolerating the medication properly. So I would put the patient in a position of comfort. I would make sure the bed is low and locked. I'd ensure that the patient's skull bell is in reach. I would discard my supplies. I would remove my gloves. Perform my hand hygiene. And go document my procedure.